All right, let's talk about one of the most powerful, and let's be honest, one of the most misunderstood financial tools out there, the Flexible Spending Account, or FSA. Think of it as a secret weapon for saving money that's probably hiding right in your employee benefits package.
So let me just ask you this. What if you could get an instant, like 30% discount on things you're already paying for anyway? We're talking dental checkups, new glasses, even your kid's daycare. It sounds way too good to be true, I know, but that is exactly what an FSA can do. So how on earth does a 30% discount just happen? Well, it's not magic. It's just a much smarter way to pay for all those everyday expenses. Let's break it down. Okay, so an FSA is basically a special account that your employer offers. It lets you tuck away a part of your salary for specific expenses. But here's the key, the magic trick. This money is taken out of your paycheck before the government calculates any taxes on it. And honestly, that's it. That's the whole secret, the entire advantage. The secret sauce is all wrapped up in that one simple idea, pre-tax. This is the key that unlocks some serious savings. So let's really dig into the secret tax advantage, because this is where we get to the why. This is where you see the real financial power of an FSA at work. When we say pre-tax, what does that actually mean? It means the money you choose to put in your FSA is basically invisible to the IRS. It's shielded from federal income tax, Social Security tax, and Medicare tax. Poof! You just don't pay those taxes on that chunk of your income. Seriously, think of it this way. Because you're not paying taxes on that money, it's pretty much like the government is handing you a coupon for roughly 30% off every single eligible thing you buy. It's an immediate built-in discount. And those savings? Oh, they add up fast. If you're in about a 30% tax bracket and you max out your healthcare FSA contribution, we're talking about saving nearly $1,000 a year. That's real cash back in your pocket. Let's look at the actual math here because it's pretty wild. To pay a simple $100 medical bill with your regular bank account, you first had to earn about $143 because about 43 bucks of that went straight to taxes. But with your pre-tax FSA dollars, you only need to earn $100 to pay that $100 bill. The actual cost to you is way, way lower. Now, it's important to know that not all FSAs are created equal. There are few different kinds, but they all have the exact same goal, to save you a bunch of money by using pre-tax funds. The two big ones you're going to see are the Healthcare FSA and the Dependent Care FSA. The healthcare one is for all the medical, dental, and vision stuff for you and your family. The dependent care one, that's specifically for things like daycare that you need so you can go to work. So for 2025, you can put up to $3,300 into a healthcare FSA, and this covers a huge range of things you're probably already buying. I'm talking doctor copays, prescriptions, dental work, contacts, and even everyday stuff like Advil or a first aid kit. Now, the Dependent Care FSA has an even higher limit, $5,000 per household. And for working parents, this is an absolute game changer. It covers daycare, preschool, after-school care, even summer day camps for your kids. And hey, there's one more you might see out there, the Limited Purpose FSA. This one is specifically for people who also have a health savings account or an HSA. It lets you kind of double dip on tax savings by covering just your dental and vision costs, which keeps everything nice and legal with the IRS. Okay, this all sounds great in theory, right? But how do you actually get your hands on this money and use it? Let's walk through the super simple steps of putting your FSA to work. It's a really easy process. First, during open enrollment, you just decide how much you want to contribute for the year. A little pro tip here, just look at what you spent last year on copays and prescriptions to get a good estimate. Then, a little bit comes out of each paycheck automatically, pre-tax. And finally, you just spend it, usually with a super convenient debit card. And that debit card, it is a huge deal. The old way, you had to pay out of your own pocket and then fill out paperwork and wait to get reimbursed. Ugh. Now, most plans just give you a debit card. You just swipe it at the pharmacy or the dentist, and you're done. No hassle. All right, we have to talk about the elephant in the room. The number one reason people get scared and don't sign up for an FSA. It's the fear behind that famous or infamous phrase, use it or lose it. We've all heard it, right? It's the biggest anxiety about FSAs, this fear that you're just going to forfeit your own hard-earned money if you don't spend every last penny. But here's the thing, that's not really how it works anymore. So that old fear, it was totally real. Back in the day, if you didn't spend it, it was gone. But the modern FSA is way more flexible. Today, most companies offer one of two awesome solutions to give you peace of mind and protect your cash.
So here are your modern safety nets for 2025. Your plan will probably offer one of these. Either a carryover, which lets you roll over up to $660 into the next year, or a grace period, which just gives you an extra 2.5 months to spend down your remaining balance. This flexibility is a total game changer. It makes it so much safer to plan your expenses and contribute with confidence, because you know you have a backup plan. It gives you some real peace of mind, too, just knowing that money is sitting there, ready for you when you need it.
And really, at the end of the day, it's a true win-win situation. You, the employee, get that awesome 30% discount on things you need, and your employer wins too, because they save money on payroll taxes for every single dollar you contribute.
So, as open enrollment starts to pop up on your calendar, this is your chance to take advantage. The only real question is, now that you know how it works, are you going to keep leaving that free money on the table?